Thank you, ladies and gentlemen. We're just waiting for colleagues to come in from the waiting room. So we'll just give it, say, 30 seconds, a minute more before we actually start formally. Okay, thank you very much indeed. Good morning, good afternoon, good evening. Greetings from Chatham House in London. My name is Robert Yates. I'm the Executive Director for the Centre for Universal Health, where we specialise in issues relating to the political economy of health and universal health reforms. Today we've got a very special event that we're doing research at the moment, looking at the impact of COVID-19 on global health and what lessons can be learnt from this crisis this year, particularly as it relates to the issues of health security and universal health coverage. Throughout this crisis in 2020, we've had world leaders and thinking particularly of the United Nations Secretary-General and the Director-General of WHO, talking about the need for national and global solidarity. You'll hear people talking about we're all in this together. No one should be left behind. No one is safe until everyone is safe. But looking at the events of this year, how has the world lived up to these ideals? Today, with our very distinguished panel, who I'll introduce in a moment, we'll be looking at these issues to unpack what do we mean by global solidarity? What has worked well this year? And where perhaps has solidarity been undermined by certain events and individuals? But most importantly, what are the lessons for global health coming out of this crisis? I should emphasize that our meeting today is on the record. In fact, it's being recorded. So it's not following the famous Chatham House rule. But we're very keen to encourage people to ask questions. This isn't just our panelists talking to you. We're very keen to hear from our audience. And we'd like you to use, please, the Q&A function to ask questions, not the chat function, but the Q&A function. And if you see somebody asking a question that you particularly like, if you upvote it with the thumbs up sign, then that promotes questions up the list, and being democratic, we can then ask the most popular questions. So without any further ado, if I can introduce our panel, and we've got a wonderful panel to talk to us today. First of all, we have Dr. Zsuzsanna Jakab, who is the Deputy Director of the World Health Organization. Then we have Mary Robinson, who is Chair of the Elders, former President of Ireland, of course, and former UN High Commissioner for Human Rights. And finally, Professor Keizo Takemi, who is a member of the House of Councillors of the Japanese Parliament, the Diet, and is also a WHO Goodwill Ambassador for universal health coverage. So I've asked our panelists if they could speak to us, giving us some introductory remarks for about 5 minutes. And if I could come to you, first of all, Zsuzsanna, what's the perspective of WHO as to how the world has performed, particularly looking at how there's been solidarity or lack of solidarity in tackling this crisis?
Well, good morning, good afternoon, and good evening, everybody. And thanks, first of all, to Chatham House for organizing this event, and particularly special thanks to you, Rob, for bringing us together. And although there are many events, but it's never enough to discuss universal health coverage, health security issues, because we don't want to give up on our dreams, even though sometimes we get some setback. And our dreams are laid down in the Sustainable Development Agenda, in GPW 13 for WHO, and we still want to achieve them, even though maybe the timeline might be a bit extended, but the dream should never be given up. And it's a particular pleasure for me to sit on this distinguished panel together with my colleagues, which is a wonderful group of panelists, and thank you for them for accepting your invitation. So in my introduction, let me highlight a few issues. First of all, COVID-19 is the greatest global shock in decades. Countries in all income groups have been affected, including those scoring well traditionally on health security and also on UHC measures. At the same time, the pandemic has also shown that in a globalized world, We are only as strong as our weakest link. And therefore, solidarity has to be a core component of the response. Together has been the motto we used from the beginning. This applies to all levels, global, regional, and national, community level first and foremost, and requires a whole of government and whole of society approach. And this applies to both tackling health emergencies such as pandemics and also achieving universal health coverage. There are both beautiful examples of solidarity as well as serious weaknesses. Disruptions to essential services and reduced access to required health services for COVID-19 diagnosis and treatment have laid bare societal inequities and gaps in social protection. Unlike localized and regional public health emergencies, COVID-19 as a global crisis has led to a reduced external support for the countries that are most in need. The problem is exacerbated by severe global shortages and competition for critical resources, such as personal protective equipment, reagents, medicines, just to mention a few. Restrictions in global transport led to supply chain constraints. In some cases, inadequately managed market mechanisms have resulted in limited supplies being allocated to the highest bidder rather than those who are in greatest need. The same risk may occur as vaccines become available. The Access to COVID-19 Tools Accelerator, or in short, ACT-A, is a global collaboration, an unprecedented level of partnership to accelerate development, production, and equitable access to COVID-19 tests, vaccines, treatments, and an opportunity for global solidarity in managing the situation. It brings governments, scientists, businesses, civil society, philanthropists, and global health organizations together, and a tremendous progress has been made in research and development to develop the new tools, new products. COVAX is the vaccines pillar of the ACT-A, which is co-led by Gavi, CEPI, and WHO, and of course, COVAX facility led by Gavi, obviously. And it aims to accelerate the development and manufacture of COVID-19 vaccines, but also to guarantee fair and equitable access for every country in the world in the spirit of solidarity. And this is a key action in front of us to make sure that the distribution of vaccines is fair and equitable allocated to all countries of the world. Friends of the COVAX facility, co-chaired by Singapore and Switzerland, comprise countries that strongly support vaccine multilateralism and the goals of COVAX. There must now be solidarity among the countries, donors, and partners to ensure the road to recovery is equitable. This includes building and enhancing One Health approaches to health security preparedness and response to ensure that the risks of outbreaks at the human-animal interface are addressed effectively. Secondly, there must be a mutual trust and accountability, such as through the Universal Health and Preparedness Review, which was announced by Dr. Tedros during the recent World Health Assembly, which will bring nations together and neighbors together to support the whole of government approach to strengthen national capacities, commitments, and action for preparedness, universal health coverage, and healthier populations. And I'd like to underline the word accountability. Thirdly, we must start building back as part of the ongoing response to COVID-19. WHO is committed to leading and working with all stakeholders on the health comes first focus of the UN framework for the immediate socioeconomic response to COVID-19 in collaboration with other pillars for recovery. As Tedros frequently says, no one is safe until everybody is safe. Exclusion is more costly in the long run. All refugees, migrants, and other people who are on the move must be included in preparedness, response, and recovery activities. WHO has been working to improve the health of the world, advancing UHC, ensuring better protection from health emergencies, promoting health and well-being. We must build resilient health systems and advance UHC and health security. And this should be done by first leveraging on the current response to strengthen pandemic preparedness and the links to health systems. Secondly, investing in essential public health functions for the most vulnerable, but for everybody included. Thirdly, investing in institutionalized mechanisms for the whole of society engagement. Fourthly, promoting enabling environments for research, innovation, and learning. Fifth, increasing domestic and global investments in the health system and emergency risk management. Six, addressing pre-existing inequities and the disproportionate impact of COVID-19 on the vulnerable. And finally, building resilience to climate change into the core functions of the health systems. Equitable, effective, and resilient health systems should be primary healthcare based. Primary healthcare is rooted in our commitment to social justice, equity, solidarity, and participation. And close links between UHC and primary healthcare are required, the better being the engine of universal health coverage, and therefore the UHC partnership program is key in building back. And there is a strong support, and we need a strong support from the multilateral system. In this regard, the SDG Global Action Plan for Healthy Populations with 12 multilateral agencies will provide a good basis for the collaboration ahead of us. It can also accelerate the progress in areas like primary healthcare, leaving no one behind, and innovations and data. So with all these components in place, countries will be better placed to implement the international health regulation, which will be key, and achieve UHC. And in summary, 3 issues. 1, make health systems more resilient, a #1 agenda. 2, the One Health approach as a priority in moving forward, but not only the animal and human interface, but also engaging with the environments, the ecosystem in which we live. So move from tripartite to quadripartite collaboration. And finally, the climate-related issues have to come to the forefront, and health issues as the #1 priority in the socioeconomic development. Thank you. Back to you.
Wonderful. Thank you very much indeed, Zsuzsanna. And I think it's especially important you emphasizing that this should be an all-of-government approach and sort of led by the head of government. I think we've seen this mistake as far too often health is sort of left to the health sector, and we're all sort of seeing to our cost that, you know, that's totally inappropriate. Now, the elders have done a lot of work on universal health coverage, and you know, they have been very much engaging with heads of state, ministers of finance on this issue. So who better to bring in than the chair of the elders, Mary Robinson, to talk to us now. Mary, what are your thoughts on solidarity in tackling the pandemic and UHC?
Thank you, Rob, and I'm very happy to participate in this panel as chair of the elders, because as you said, promoting universal health coverage is very dear to our hearts, and it does require solidarity. And building on the work we've been doing over the last few years, the elders this month published a new set of policy recommendations entitled Building Back Better for Universal Health. The report sets out 3 key priorities for leaders. First of all, to prepare public health systems for future pandemics, to learn the lessons from COVID-19 and define pandemic preparedness and response as a global public good that necessitates a multilateral approach with states and global institutions pooling resources, capacity, and expertise to support the ongoing work of the WHO. And it was very good to hear Zsuzsanna on that today. The Global Preparedness Monitoring Board and the Independent Panel for Pandemic Preparedness and Response, with full respect for their independence and expertise. Secondly, to prioritize universal health coverage at national and global level. 5 years on from the adoption of the Sustainable Development Goals, it's important to make their implementation a key priority, including on universal health coverage, so no one is denied the healthcare they need on grounds of cost. To turn the disruption to economic, social, and political models engendered by COVID-19 into a catalyst for wider pro-health reforms as governments recalibrate budgets and political agendas. And thirdly, to promote healthier societies via holistic policies and social development. In other words, to tackle the root causes of disease and sickness, including poverty, malnutrition, hunger, and structural discrimination of women, girls, and marginalized groups, and to support and empower the WHO, show global solidarity via sufficient funding to tackle the fragility of health systems in the global south. So, reflecting a little bit on global solidarity, obviously, global solidarity in tackling COVID-19 means that we all share a common purpose in eradicating the virus and mitigating its effects, and that we recognize that we can only achieve this if we work together and help each other. When it comes to tackling COVID-19, the COVID-19 pandemic and future outbreaks of infectious diseases, Tedros has said no one is safe until everyone is safe. The fact that this crisis has affected every country in the world, as Zsuzsanna has already emphasized, and people of all income levels, demonstrates that we are indeed all in this together. Nobody should be left behind, and this shouldn't be a slogan. If we build back better, we must deliver on a goal of universal protection, and that must be achieved equitably, prioritizing those with the highest needs first. And this will require solidarity within and between countries to ensure that everyone receives the full range of services they need to protect their health and economic well-being. And this inevitably means that wealthier country members of society must pay for vital services for the sick and the poor. And these are obviously the principles underlying universal health coverage. We at the Elders have been campaigning for UHC for many years now, and many of us have campaigned in our own countries as well and with other global bodies. And we're delighted to see that the global UHC campaign has flourished over the last decade, but the success has been a compelling example of global solidarity involving all major multilateral health agencies led by the WHO and civil society organizations. And yet the events of 2020 show that these efforts haven't been enough. And collectively, we have to admit that even in countries with developed UHC systems, we fail to protect people adequately from this virus. So we're conscious that a number of international reviews are underway to investigate what went wrong and what lessons there are for global health. But it already appears that there has been a relative neglect of collective public health services compared to curative services for individuals who can pay, of course. We're warned about this, for example, by the Global Preparedness Monitoring Board chaired by my fellow elder, Gro Brundtland, whose report in September 2019 was called A World at Risk and predicted a pandemic just like the one we're now experiencing. And it's a sad indictment of the world's failure to demonstrate solidarity in pandemic preparedness that this year's report of the group is called A World in Disorder. It's also time to give a much higher priority to addressing the social determinants of health, including, of course, tackling the climate emergency that I was very glad Zsuzsanna referenced, which poses an existential threat far greater than COVID-19, and where again, global solidarity will be critical in bringing about universal protection. So the Elders' recommendations in our new report are built on principles of human rights, equity, and solidarity. We argue that COVID-19 has shown we're only as safe as the weakest link in our human chain. It's only by embedding solidarity and justice in public health policies that the world will truly overcome the current crisis and face the future with confidence. So I look forward very much to the discussion. Thank you.
Thank you very much indeed, Mary. That's fantastic. And I know that the Elders have been very active at a country level over the years as well. I mean, are there any sort of particular countries that you would sort of flag where you can sort of think there may be an opportunity to accelerate universal health coverage reforms, perhaps maybe where the Elders are engaging with heads of state at the moment?
Yes, we've been engaging with a number of countries. I was in Tanzania with Graça Machel, for example. That's a country that could do more and seems at times to be making and it just needs encouragement, I think. Indonesia is another country where Ernesto Zedillo and Gro Brundtland have done quite a lot of work. South Africa, We've worked with President Ramaphosa, especially Ricardo Lagos and Graça Machel herself. And even in the United States, I remember participating in an event in San Francisco, and I know that Ban Ki-moon and Ricardo Lagos were with me there. And in New York, Gru Brundtland, and indeed Jimmy Carter has spoken out strongly on universal health coverage, even though he's now an elder emeritus and no longer actively involved. But thankfully, we can still rely on our retired elders to support the cause. So we are very active, and we're very keen to encourage governments. And I think this pandemic, in many ways, helps because it exposes the fragility.
Yes, absolutely. And I think, encouraging heads of state at this time to recognize that UHC can bring tremendous health, economic, societal, but also political benefits, is absolutely vital.
Economic and political benefits.
Absolutely, absolutely. Now, if I can maybe sort of turn to Professor Takemi now, that Japan has been at the forefront of the debates around universal health coverage over decades now, and has a very proud history of having introduced universal health coverage in 1961, and I think has been sort of leading a lot of the efforts to encourage governments to look to UHC reforms. Professor Takemi, how do you see the pandemic, sort of panning out across the world, and the role of Japan in extending health security and universal health coverage?
Yes, I'm very glad having the wonderful occasion to talk about the solidarities and the universal health coverage and the crisis management against the risky infectious diseases simultaneously. The solidarity is a core part of the value on which we can collaborate and we can help each other. So now I would like to pick up the first question you gave me, that what does global solidarity means and how important it is? The public health emergency preparedness and response capability. In this context, I can say that I would like to recall the constitution of the WHO itself. The health of all people is fundamental to the attainment of peace and security, and is dependent upon the fullest cooperation of individuals and state. This is now we should recognize once again, this is the real meaning of the solidarity, I think. And in response to a health crisis, solidarity is not a charity and a mercy. We should recognize that we need to stand in solidarity to protect ourselves. The quote, "No one is safe until everyone is safe," unquote. And quote, "No one's health will be left behind," unquote. It requires that the preparation of the resilient and inclusive and quality assured healthcare system from the peacetime. And the infectious diseases don't choose people. The biggest differences between an infectious diseases pandemic and the other disease control is that a pandemic cannot save the strong unless it saves the weak.
Mm-hmm.
The quote, "We are," the Secretary-General Guterres stressed at the launch of the economic report on the COVID-19 pandemic. And the second question was, where has solidarity worked well? And conversely, where has it not worked? This is a wonderful question. But the level and differences of the solidarity, I would like to mention. The solidarity became a strong factor and also spirit in a country where the freedom and democracy are shared as a fundamental core concept. So the soft and hard countermeasure by the government and response of people is reflected from the extent of the spirit of the solidarity. For example, in our region in Asia and the Pacific, the Japan, Australia, and New Zealand is that sort of a country. And the second, category, I can say that the country with an authoritarian system, even though extent of the solidarity is insufficient, unfortunately, in the authoritarian system, they can more easily build up those controlling system for individual action with some human rights concern. Digitalization and the monitoring and controlling individual actions positively work for contact tracing. So it's a kind of unfortunate paradox. We can find out that the democracy and also the other side, the crisis management system building and the area of the digitalization. So the final case is that there are some democratic countries we have, where the national security preparedness and system effectively supported the decision-making and countermeasures for because of the national security countermeasures. Several divided countries in Asia are just like that. And finally, the third, what are the emerging lessons for the governments and the global community? The construction of global health governance is emerging very serious issues as a common, I think. The access to the COVID-19 tools, accelerator, is a groundbreaking global collaboration to accelerate the development and production and equitable access to COVID-19 tests and treatments and vaccine. One of the pillar, the COVAX facility, accelerated and boosted the international cooperation at the beginning by the middle power countries, not like the superpower countries. And in the decision making of the sovereign state, it is the same in every country that their own people come first. This is a bit unfortunate under the pandemic. However, how those of the countries can contribute for the global health governance as well. This is the challenge, and the solidarity should be the basis of our commitment on those of the common agenda under the pandemic. The government of Japan is planning to support low and middle income countries to strengthening its access and delivery system for the immunization, which will be critical challenge shortly by the bilateral cooperation. And personally, I think that I believe the donate extra doses of the vaccine into low and middle income countries through the COVAX facilities could be a realistic option for the Japanese government, as Canada, Norway, and some of the EU member states started the decision. I think the Japanese government should join it to utilize the delivery system of the COVAX facilities for the remaining, our stock of the vaccines in the near future, I think. And from these step-by-step discussion within the developed countries will lead to deep understanding and the acknowledgement of people in each country and strengthen overall solidarity movement. And finally, I mentioned that neither United States of America and China will lead the post-coronavirus, the global health governance. And however, the rise of the middle power countries will lead the accelerate to the construction and the reconstruction of the global health governance after the coronavirus will convergence. The challenge and the opportunity to foster and sustain the solidarity is that host nations such as the United Kingdom can lead the G7 next year, and how Italy is the host of the G20, can lead the G20 in the next year to strengthen the solidarity among the countries through those schemes can be a very important challenge of us to commit on. Thank you very much.
Thank you very much, Keizo. That was excellent. And I think very important to stress the importance of multilateralism and the role of the G7 and G20. And maybe a question I can pose you and to the other panelists as well is around the United States. You know, obviously we've seen extraordinary events in the United States this year, you know, with the US pulling out of not only sort of the Paris Climate Agreement, but also the, you know, WHO. How important do you think it is for global solidarity to bring the United States back on board, and how potentially are we going to achieve that? Zsuzsanna, do you have any sort of thoughts on that vis-a-vis WHO, for example?
Well, this is absolutely crucial to bring US back. US is a very important global health leader, let's put it this way, and we very much missed their input in several fronts. And we are extremely hopeful that with the new administration, this will turn around and change. And the first opportunity for that will be the executive board in January. Actually, the US administration takes office exactly in the same week when we have the executive board. We expect them to come with a strong delegation. They are already working with other groups of countries to have input into the WHO reform and the transformation agenda. And we hope that they will also join the Act A to speed up the process for the fair and equitable allocation of resources and vaccines. So we are hopeful. We are full of hopes. And they are an absolutely vital player. We need US. We cannot progress without US in the same way as with them. Thank you.
Thank you, sir. Mary, have you any thoughts on the likelihood of the US coming on board?
Well, I do think that the United States is under a Biden-Harris administration is bound to quickly rejoin WHO and support it. But I'm glad that the elders are free to speak out and criticize the United States for an extraordinary failure over the years in having a proper public health system. I'm aware of how strongly critical Ban Ki-moon was when we were together in San Francisco promoting universal health coverage and commending California for being ahead of most of the rest of the country. But Ban Ki-moon spoke explicitly in a way he couldn't have done as Secretary General. And that's a good thing about the elders, that we can actually speak out. And it is evident now. Obviously, there has been bad leadership from the Trump administration in dealing with the COVID crisis, and that has cost lives, it has cost health, it has cost the economy of states enormously, and it has cost the reputation of the United States enormously in looking so dysfunctional in many ways. But I know there's very good work being done at state level, but I think COVID has exposed the fact that you cannot protect your people if you don't have a public health system that's functioning. And hopefully that lesson will be learned and driven home by a Biden administration that understands the importance of access to healthcare.
Yes, thank you, Mary. Yeah, it is quite extraordinary in global health how often the United States is almost seen as a separate planet, really, that we talk about health systems right across the rest of the world, but none of us outside the US engage in the US. And I agree wholeheartedly. I thought it was very commendable at the elders to engage in the debate there. And one seen, I think, through this pandemic, I think 15 million Americans have lost health insurance because of, it's linked to employment, of course, in the US. And, explicit, the US has moved away from universal health coverage. So, sort of maybe this will sort of be the final wake-up call that the US needs a UHC system. Keizo, what do you think? Do you think that's likely? I mean, are you optimistic that things are going to improve in the US and they're going to come more on board?
Absolutely. Even under the Trump administration, the Japanese government and ourselves consistently encouraged them to commit on the accelerators and the COVAX facilities in so many channels. But unfortunately, under such a political circumstances of the presidential election, we can not realize those the result and outcome from those our commitment. But I strongly hope that the administration will be back to our global health community and as the real friend of us to strengthen the capacity of global health governance in the most efficient manner. The reform of the World Health Organization is the core part of it. But I really hope that the major stakeholders, both the public and private, more closely collaborate each other to design and strengthen those are the core part of the reform of the WHO in the future.
Terrific, thank you. Right, now I'm going to start bringing in audience questions now, and I've noted one in particular from Dina Mufti, who I'm not sure if she'd like me to ask the question or if she'd like to come online. I'm just seeing that if yes, Dina, if you're happy to unmute and ask your question, or if you prefer me to, I'm more than happy to. Just to sort of to mention that a number of you have mentioned that the COVAX facility and the ACT accelerator, and I think this is almost an acid test for the world in how do we ensure an equitable distribution of COVID-related commodities going forward. Now, we've discussed a little bit around vaccines. Dina's question was specifically around treatments, and as treatments may be coming online as well. What do you think are the prospects of the ACT accelerator really going to be able to deliver equitable and truly universal coverage, particularly given its funding levels at the moment? Do we need more funding for the ACT accelerator? Zsuzsanna, perhaps if I can start with you there as the custodian of this great initiative, which I think is truly a wonderful example of global solidarity. But how do you feel it is being supported at the moment? Is it sufficient, the amount of funding that's being put into it?
The amount of, can you hear me? Let me see. Yes, yeah. I'm not muted. Okay. So the amount of funding is never enough, and it is not enough, clearly. We just had the Facilitation Council meeting earlier this week, and we highlighted the need of about 5 billion before the end of the year, and some 28, nearly 30 billion up to the end of 2021 to buy the tools and to invest into the health systems. But within the COVAX facility and also with the World Bank money that the World Bank put into it, this famous 12 billion that the World Bank put aside for countries that are eligible for World Bank loan, that already gives input into the possibilities to buy the vaccines. I can see, in addition to the funding challenge, I can see two additional issues. One is the issue on the supply side. On the supply side, the supply will come from two sources. One is the agreement between the COVAX facility and the pharmaceutical companies. And as soon as the regulatory process moves forward, this falls in place, like the first one will be with the Pfizer vaccine, and then this will be followed by others. But the other element of the supply chain is exactly what Professor Takemi mentioned, is the donations from the countries, because many of the countries have ordered more than what they need for the population, even if you take some 60% of population coverage into consideration. At the global level, we envisage 20% globally by the end of 2021. But even if you take 60%, some countries have ordered the multiple of this for their population. So there is an option there for donation, which is excellent. And it's very good that we have the COVAX facility as one entry point. And we advocate both with the EU and also bilaterally with UK, US, Canada. And now I heard from Professor Takemi also we should reach out to Japan as well to ensure that we use this one entry point through the COVAX facility, because we have the principles for the fair and equitable allocation. And now that many of the high-income countries started to vaccinate and will start to vaccinate, it is absolutely crucial that we use this momentum also to start a first batch of vaccination in the low and low middle income countries. And we are working a lot on country readiness. This also has the element that the regulatory processes have to be in place. So there is a country readiness element. So we are now finalizing a list of countries that are ready to move forward early next year. And we need to finalize the supply side to ensure that there is enough vaccine available. A lot of work ongoing on this, I can assure you.
Right.
Back to you.
And Mary, so thinking of the elders, and you say the elders being prepared to speak out and tell it how it is when it comes to issues like this. What's your perspective on how we're performing in equitably distributing these commodities?
Well, the elders are very supportive, both of COVAX, but also of the ACT Accelerator. And it's good for me to take part in this panel and listen to Zsuzsanna and listen to Professor Takemi, so that I can, take their wisdom and use the voice of the elders to amplify the points that need to be made, because, COVID has decimated developing countries. Money has flown out of the continent of Africa, for example. The remittances are well down because people don't have jobs in the rich parts of the world, and the debt has risen hugely. And then on top of that, you have the need to have the fiscal space to strengthen health systems. So all of that it means that at least where there has been this wonderful cooperation, I must say, on developing vaccines, that's one of the really good points, then that has to translate into equitable access. And I couldn't agree more. And we have to start now visibly with a batch going to low and middle income countries, as well as the rich countries beginning to address the problem for their populations. That's, I think, extraordinarily important for a perceived equity in our world that will promote solidarity.
Yeah, couldn't agree more. I mean, we in the UK, I think, have 380 million doses now, and our population is about 60 million. And all the talk is about, oh, we'll all get vaccinated so we can go on our summer holidays. And it just seems preposterous that we can be talking like that when there are countries that have basically got no supplies whatsoever at the moment. Keizo, any thoughts on sort of how sort of Japan is sort of helping this process along, and sort of maybe encouraging other partners to chip in appropriately to COVAX and the fair distribution of commodities?
We try to strengthen the capacity of the COVAX facilities, and the already funded, but it's not enough yet, as you mentioned. There are the huge gap, unfortunately, we have. But the other subject is this is still the governance issues is going on for the COVAX facilities. We have to re-strengthen the governance structure of the COVAX facilities and create more efficient scheme in which we can develop and allocate the limited resources for all the people beyond the national boundaries. So the governance restructuring for the COVAX facility is the other subject we have to think. But Mary Robinson mentions that we have to take wisdom. Every policymakers in the sovereign nation inevitably pay attention on their own people first. This is inevitable. But on the other hand, as a result of their own people first, for example, Canada has pre-ordered almost 9 doses of the COVID-19 vaccine per person. The one article on the Nature mentioned about it. And the Japan, in the case that almost 2 of the COVID-19 vaccines per person. So it is quite obvious in the near future, we can clarify how many the remaining doses of our own stock can be delivered for the people in the low income and middle income countries. Now, how we can develop the delivery system, which can be the same system of the COVAX facilities, and then we can efficiently reallocate the vaccines, for the people. That's sort of a new challenge we have to think at that time, it is quite sure that we should have the real wisdom for it.
Yeah, brilliant. Thank you very much indeed. A number of you have addressed issues around the politics of the allocation of resources, and we recognise that access to healthcare is an extraordinarily political issue as well. Now, we got an interesting question, if I can just find it, from Michael Jennings, and I'm not sure if Michael would actually like to come on air, as it were, to ask the question. Michael, over to you.
Thanks. So, as you say, I'm Mike Jennings from SOAS University of London, where we've taken the lead on thinking about what decolonisation means for university teaching and research. And we know that the institutions of global health are based largely in the global north, and the leadership of these institutions is also overwhelmingly dominated by citizens of the global north countries. And I was wondering to what extent you think this presents a challenge for meaningful global solidarity in global health, and whether this is also a moment for thinking about the decolonisation of global health. Thank you.
Great, thank you. Super question, Michael. So I'm not sure any volunteers to take that one on first.
Okay, I'll
Thanks, Mary.
I'll step in. Now, I think this is part of a movement that has been, if you like, really accelerated by COVID-19, because COVID-19 has been a mirror exacerbating all of the inequalities and brought out that we have to go to the root causes. And colonization has been very much a root cause of these inequalities. And that translates over to the the governance of health. And I agree with Professor Takemi, we need to address strengthening that governance, but we need to do it equitably. And we need to do it in a way that reflects the real world and that values diversity and values having a genuine approach based on diversity, equity, inclusion. And that would be very much in the interests of global public health and universal health access. So I'm glad that SOAS is pushing that a bit, because I think we do need, as the Black Lives Matter remind us and others, we do need to address these issues. And I think we'll understand better. I talk about the inequities of climate, and there are 5 layers of inequity. Not just that it affects the poorest countries disproportionately and much earlier, even though they're not responsible, the gender dimension, the intergenerational dimension, the different pathways to development, which is the kind of part of the colonization issue, and the injustice to nature. And that's when you're dealing with climate, so we need to look at health with a similar lens also of equity and justice, as the elders would encourage.
Terrific, thank you. And Zsuzsanna, I'm not sure, is this an issue that WHO is addressing? And maybe just wondering the role of maybe sort of the regional bodies in WHO in tackling this?
Yeah, definitely. I fully agree with what Mary has said and full support to that. There is one more element that I'd like to bring into this discussion. And this is the fact that we also need a paradigm shift when it comes to investing into health and health services. Because until now, we have invested all the funding into institutions, invested all the funding into disease-specific work, but we have never invested into public health issues, into prevention activities. If you look at the most developed regions in the world, 97% of the healthcare expenditure goes into institutions. And these are not funding around people, around patients. These are funding around institutions and interests of those who are running these institutions. Plus, these are not investment into prevention and public health functions. So this paradigm shift in moving forward is very much important. And the COVID has brought this to the surface. So we have seen, Mary has also said in her introductions, and I fully agree with her, that we have to invest into the root causes, into the determinants of health. Without that, there will be no progress. And the essential public health function should be considered as global goods, which are publicly funded, because otherwise we will not get out of this situation. So that's an additional dimension. And we are dealing with all this now under the banner of how to make our health systems more resilient. But the issue is the same.
Mm-hmm. Terrific, thank you. Actually, that leads very neatly, I think, into a question we got from Toby Bonvoisen. Would you like to bring your question to the fore? I think you're unmuted.
Hi, yeah, thank you. There seems to be a bit of a tension between the patient-facing healthcare services and then the other public health services that are more focused on outbreak control. How can these crucial aspects of surveillance of infectious diseases, such as adequate microbiology lab staff and equipment, be embedded into the provision of new universal healthcare?
Right. So I don't know, Zsuzsanna, do you want to sort of take that on first?
Yeah, when I say essential public health functions, this is exactly what I have in mind, Toby, and thank you for raising it. We absolutely have to invest into surveillance, into laboratory capacity, into detection of health threats, and everywhere in the world, not only in the least developed countries. What we have seen also was a lot of weakness in the most developed countries because they have always considered as communicable diseases belonging to the past or belonging to the fragile countries, and they have nothing to do with it. And therefore, the capacity to tackle with outbreaks like contact tracing, it has gone. In many of the countries, there is no public health capacity. So these essential public health functions are key, and there is a long list, from surveillance, detection of health, laboratory capacity, health protection, prevention, promotion, and all this. And we have to agree what we mean, what is the definition of essential public health function. There is one definition in PAHO, another one in Europe, but we have to agree on a global one. And then make sure that this becomes part and parcel of a strong preparedness and response to the health system. And as I said earlier, we also have to establish a very close link between preparedness and the health systems, which was a missing link, preparedness and IHR. With preparedness of the health system, it was a missing link, and we have to invest much more into preparedness of the world to avoid this panic and neglect approach that we have now. Because basically we are panicking, then there is all of a sudden funding for the outbreaks and the pandemics. But when the pandemic is gone, we forget about it, and there is zero funding for preparedness. So this is a vicious cycle, and we have to come to an agreement with the politicians on this.
Yeah, yeah. I know this was an issue that I think the elders brought up, Mary, this fragmentation between public health and preparedness and the health systems on the other hand. Do you have any particular thoughts about that?
No, just the obvious point. Because countries in Asia had SARS experience, they had much more emphasis on the public health dimensions of surveillance and contact tracing, etc. And it has worked. And then, in the United States in particular, but also in Europe, we're seeing, very dysfunctional in many ways. And we're seeing, holidays like the holiday coming up being very important for politicians. So, they're very ambiguous. And these are obvious points, but actually what we need is that holistic approach that we're talking about, which includes a great emphasis on preparedness, on public health, on the social dimensions of health, the link with climate, and so on.
Mm-hmm. Thank you, Mary. And I think our UK audience would very much identify with your thoughts about this disconnect and coming up to the Christmas period, the confusion around that. Keizo, looking at sort of Japan, how do you feel that you've done in sort of integrating, the public health with the health system?
Oh, it's a very serious challenge in the domestic the context. As most of the countries as well, the government quite separately operate the public health services. On the other hand, the primary healthcare services or their own health system. So how we can efficiently integrate those services is a real challenge, not only for the low-income countries and middle-income countries, but also for the advanced nation as well. And in addition to that, we can think some regional approaches for the system building for both sides. For example, as I mentioned, that the ASEAN countries now try to build up their own regional emergency operation center in collaboration with Japan and other countries. This system building will be inevitably relate to each country's health system. And then this system building can be a kind of the catalyst for those the separate approach of the public health services and the health system building. Therefore, always the decision makers have to think that how the collaboration for the system building against the risky infectious diseases can be a catalyst to integrate the different approaches of the public health and the primary health care and those health systems strengthening to achieve the universal health coverage.
Great. Thank you. I think we're going to have time for just one more question before the top of the hour. So I'm not sure if Sweking Kaur is on from Malaysia. Do we have Sweking on? Yes.
Hello, Rob. I'm here.
Hi. Terrific. Would you like to ask your question?
Of course. Thank you to all the panelists for a great session. Despite all the rhetoric that's happening around solidarity, the world remains organized in nation states, each of which are self-interested and have every incentive to take care of their citizens. First, on the back of rising populism and nationalism, my question is, how can we harness these powerful forces to aid in the quest for universal health coverage? Over.
Great question. So I think this is a good one to sort of, sum up a lot of the discussion. So I'm not sure who would like to take that one first.
Well, maybe if I can come in, because the elders feel so strongly the importance of the multilateral solidarity. And we have our paper on multilateralism. We're very strongly supportive. And we do believe that COVID has taught the world a lesson about our human fragility. We're all set back, countries rich and poor. And it's a real lesson that we cannot deal with many of the world's problems at just country level, as the question has posed. We need to reinforce, we need to address and conquer the populist tendencies. Luckily, we'll have a Biden-Harris administration, which will come back to reinforcing multilateralism, which will be helpful and will make it less easy, because I think the Trump administration somehow permitted a populist way of doing and an autocratic way of doing and a nationalist way of doing, because that was what Trump himself was promoting. And that was quite damaging to our system. So now we have to, with humility, reinforce the multilateral system and the solidarity of that multilateral system. Things like the Sustainable Development Goals. In 2015, 193 countries signed up to leaving no one behind, and everything that's in those Sustainable Development Goals. We need that spirit again, and strongly.
Terrific. Thank you very much indeed, Mary. Keizo, concluding thoughts about sort of multilateralism and solidarity.
Since the beginning of the 21st century, we are facing the very negative reaction against the globalization. Even though we are having very speedy globalization itself. On the other hand, one of the negative reaction against the globalization is Trump administration in the United States of America, I think. But the same thing happened all over the world. But how the policymaker should be responsible to manage the nationalistic sentiment and to strengthen the spirit of the solidarities beyond the national boundary. Those are the cool and realistic, the political leadership is always required to strengthen the spirit of the solidarity beyond the national boundaries. If the policymaker always rely on the populism and the nationalism, we cannot overcome the coming difficulties under such a risky, infectious diseases pandemic. So those political leadership is very, very responsible for it.
Terrific. Thank you very much indeed. And how appropriate we finish with the World Health Organization. Zsuzsanna, what's your thoughts about sort of combating this nationalism and populism and building true multilateral solidarity?
I agree that there is a lot to learn from the COVID experience. And this is why it is so important that we do a proper evaluation of what was right and what was wrong during the COVID. Because that will help us also to move to a new stage of solidarity and to support the multilateral solidarity. If we want to avoid future pandemics, we have to work together, because with the present globalization and the speedy globalization, the spread of the viruses and different other bugs, but also issues in connection with One Health approach, human-animal interface, then biodiversity issues, environmental climate change issues, can only be tackled together in a holistic approach, but also only in the spirit of solidarity. So I think to get this evaluation right is absolutely important. And then the second element that is very important is the issue of accountability, because that was the missing piece. We dealt with accountability in various panels, but what was lacking is accountability from all member states working together in the spirit of accountability to live up to those global targets and goals that we have jointly decided on, and then to make sure that there is political leadership in the countries to make this happen. And this is what Tedros tries to bring in through this universal health and preparedness review that he wants to start now on a pilot basis, but then gradually roll it out to all the countries, where countries take a look to what they were committed globally and regularly report back to the international community, not to WHO, but to the international community during the World Health Assembly in a working group, what they have achieved, what they have done, and take advice from the other countries on what they should be doing better. So the spirit of accountability should go hand in hand with the solidarity.
Absolutely, we would definitely agree with that. You know, having been privileged to participate in the UHC commitments review this year, when it's obvious that a number of countries aren't fulfilling their commitments on UHC and preparedness, you know, that increased accountability is absolutely vital going forward. So we've been delighted to participate in that. I'm conscious that we strayed 4 minutes over the hour, and that I'm sure people have to get off for other meetings as well. I do apologise for I think about sort of 25 questions that I failed to ask, but obviously we'd have needed the whole morning, and even then I expect we'd have run into the afternoon. It's been an absolutely wonderful panel. I've thoroughly enjoyed it, and I hope the audience at home has as well. And just to say that, you know, we at Chatham House are delighted to partner with the government of Japan in this research project and in our work with the elders and also with WHO, and very much look forward to working with you to further the great causes of universal health coverage going forward. So thank you very much indeed for joining us today.
Thank you very much. Thank you for your leadership. It was great. Thanks for organizing it, Rob.
Thanks. Goodbye.
Well done. Thank you. Bye. And thanks to the panelists, of course, Professor Takemi and Mary.
Thank you.
Thank